Hello, I'm Elizabeth Matskin from Boston, Massachusetts, and today we will be demonstrating an ACL GraftLink reconstruction with InternalBrace technique and the new TightRope SB. As you can see here, we have our graft out on the table on our Graft Pro ready to go. We have a hamstring semitendinosus that's been quadrupled using a standard GraftLink technique, and we have our new TightRope SB on both sides of the graft. You can see the yellow suture, which is the soft button. This is just like our tight ropes we've been using for the last 10 years, but there's no metal. So for patients that may have metal adversity or a metal allergy, this is going to be perfect. There's also some other advantages to using the soft button, which you will see in our demonstration. On our TightRope SB, you can see our blue passing sutures, our white tensioning sutures, our internal brace sutures, and these tiger sutures, which are used for elongating, which you will see as we pass the button into the knee for our ACL reconstruction. On the tibial side of our graft, we can see our blue passing sutures. These suture tapes here in the middle are from our graft prep, so there are save sutures. We can see our white tensioning sutures, and then again we can see the suture that we're going to use for elongating the suture button when we pass it into the knee. So we have about a 30 millimeter femoral tunnel, so we've marked 30 millimeters from the end of this soft button. I also like to mark my graft around 15 to 20 millimeters. It's often where we have these sutures wrapped around the graft itself, but that will help us as we pull the graft into our tunnel, and we'll mark it also on our tibial side. So here we are, we're in our right knee. We've already prepped our femoral and our tibial tunnels. We have sutures passed through them so we can get ready to pass our graft with the new TightRope SB. So we're going to pass this through our suture here on the outside, and then we're going to shuttle our white tensioning sutures and our blue passing sutures through the knee here. As you're doing this, you're going to have one hand pulling through the sutures through the femoral tunnel, and your other hand holding on to the graft and the extra suture in order to feel the tension as the graft is passing. As we're getting ready to pass our TightRope SB, we have one hand holding our tensioning and passing sutures and our other hand holding the trailing sutures. This allows us to keep the TightRope SB lengthened as we pass this through. We've also switched our scope to the 70 degree so we can watch this go up our femoral tunnel. So again, we're holding both ends of the TightRope. We're watching it up the tunnel. We can see it just pass through. And we could feel it flip right there. And the other thing we can look at is we can see our mark that we made on the sutures, which is also a second way to check that we're at the same length to flip that TightRope SB. Now to deploy our TightRope SB, we can either pull on the implant or pull on the internal brace, as you can see here. And now if I go to pull on my graft, you can see that TightRope is flipped and it's not going anywhere. One nice advantage of the TightRope SB is that once we've flipped it, if we're not happy or for some reason we've flipped it on the outside of the iliotibial band, we can actually elongate it and unflip it by pulling tension on both sides of the suture, and we can watch it unflip, and we can see we can pull it back down our tunnel, and we can start all over. So this is a very nice advantage which we can't do with our metal tight ropes. And you can watch this go flip one more time, again holding both sides of the TightRope. Now that our TightRope SB is flipped on our lateral femoral cortex, we're going to shuttle our graft up into the knee. We'll watch it kind of go up into our femoral tunnel. And here comes our beautiful hamstring quadrupled GraftLink. You can see our internal brace here. So graft going into our femoral tunnel. We have marked it at 15 to 20 millimeters so we know how far to pull it in. Okay, so we have our graft pass into our femoral tunnel. Now we're going to pass it into our tibial tunnel. As you can see here, we're going to keep our tiger trailing sutures outside of the passing suture. We're going to send these down our tibial tunnel. We'll pull some of the slack out of our internal brace suture. And again, we've left behind our trailing suture because that's what allows us to pass our soft button in an elongated fashion. We can remove our femoral trailing suture at this point because that side has already been docked. And we will hold some tension on our tibial trailing suture as we reduce the graft into the tibial tunnel. Now that our TightRope SB is outside of our tibia, we can remove our tiger trailing suture and our blue passing suture. Now we're ready to tension this in our tibial tunnel. So I have a small hemostat here to take some of the tension off our TightRope SB as we provisionally take some of the slack out of it so it doesn't bunch up too much. It'll allow it to lay a little bit more flat when we get down to our tibial bone. Now you can actually put a little pressure on that button and kind of flatten it or pancake it out on the tibial bone so it lays a little bit flatter as we completely deploy it. And our final tensioning. So now we are going to fix our save sutures from our graft prep along with the internal brace in our 4.75 millimeter swivel lock anchor. So we have our swivel lock in that has fixed our save sutures from our graft as well as our internal brace, and we can cut those. And then we can still retension our TightRope SB on both the tibial and femoral sides to complete the procedure. So here's our final construct. We have our GraftLink ACL with TightRope SBs on both our femoral and tibial side with an internal brace technique.